Good morning, everyone. Good morning, everyone. I'm Dr. Laukya from Andhra Medical College, Visakhapatnam. Today, I will be presenting a paper on histopathological features of post-COVID mucormycosis patients who underwent surgery. Mucormycosis is a rare and often fatal opportunistic fungal infectious disease. It is caused by the pathogenic genera belongs to the family of Mucorrhizae. As the clinical features and imaging studies are non-specific, the definitive diagnosis requires the demonstration of characteristic hyphae in the tissue or recovery of the organism in the culture. As the yield of organism in the culture is suboptimal, hence histopathological examination plays a critical role in establishing the diagnosis and provides the evidence of tissue invasion. This is a hospital-based retrospective study. Tissue section from the 50 patients with invasive mucormycosis were included in the study. The demographic features, clinical history and treatment history obtained from the medical records. The cases were classified as rhinomucormycosis, rhinoorbital mucormycosis, rhinoorbitocerebral mucormycosis, and cerebral mucormycosis based on the clinical features and imaging records. The histopathological reports were analyzed. The histopathological reports of post-COVID mucormycosis patients who underwent surgical management were included, and the patients, those with other infections, are excluded from the study. My aims and objectives are to study the histological features in post-COVID invasive rhino-orbitocerebral mucormycosis and to determine the type of inflammation, whether it is suppurative or granulomatous, and to detect the type of spread, whether it is angio or perineural, and to detect the fungal morphology. Of the total 50 patients, males are 68% with the mean age of 53 years and females are 32% with the mean age of 49 years. In rhinomucormycosis patients, the suppurative inflammation seen in 88% and supragranulomatous in 11%. Fungal colonies seen in 55%. There is no evidence of vascular and neural invasion in these type of patients. In rhino-orbital mucormycosis patients, the inflammation is suppurative with predominance of neutrophils in 50% and supragranulomatous with predominance of neutrophils, lymphocytes, and foreign body giant cells in 50%. Vascular invasion seen in 76%, mixed vascular and neural invasion in 15%. Periocular tissue invasion in 57%. Necrosis and ulceration seen in all the samples. Mucorfungal colonies seen in 92%. In rhino-orbital cerebral mucormycosis patients, the inflammation is suppurative in 9%, supragranulomatous in 90%, vascular invasion seen in 90%, mixed vascular and neural invasion seen in 9%, periocular tissue invasion and ulceration and necrosis seen in all the samples. Mucorfungal colonies seen in 72% and mixed mucor and aspergillus seen in 9% of patients. In both rhinocerebral and cerebral mucormycosis patients, the inflammation is supragranulomatous and vascular invasion seen, necrosis and ulceration seen, mucorfungal colonies were isolated. Is a section showing blood vessel with broad accepted fungal hyphae in lumen and wall suggestive of angio invasion. Is the section showing perineural invasion. These are the section showing foreign body giant cells with fungal invasion. It's the another section showing mixed infection with aspergillus and mucor. I'm concluded with vascular invasion is the main mode of invasion. Along with it, neural invasion is seen in the advanced stage of disease, indicating the importance of neurological assessment in post-COVID patients. Supragranulomatous inflammation were common associations seen in the tissue sections of advanced stage disease patients. Mucor was the most common pathogen isolated from the tissue samples. Aspergillus was also isolated in patients with advanced stage of disease. Thank you. Thank you for the opportunity.
Thank you, Dr. Laukya. Actually, was any something different that you presented, which is not known to us? I mean, because what you concluded is what has already been discussed with mucormycosis. Is there anything else new that you want to tell us?
Neurological examination is necessary for all the patients who are presented with invasive rhinomucormycosis.
Okay, fine. Another thing, doctor, it's easy to present little pictures and some slides because there's so much of data that you just mentioned to us. It's very difficult to read through the slides as you're talking. So perhaps you could put some graphs or some bar charts or something so it'll make it presentable. Nevertheless, nice presentation.
Thank you.